Good evening, listeners. Today I am going to talk about the status and current conditions of care for senior citizens in our country. The status of senior care in our country presents a complex picture marked by both traditional values and modern challenges. While our country has a strong cultural emphasis on respect and regard for elders, societal shifts, including rapid urbanization and the breakdown of the joint family system, have led to increased vulnerability among the elderly. Government initiatives and growing awareness are slowly addressing these issues. Significant gaps remain in healthcare, financial security, and social support systems. The traditional value of filial piety, where our society places a high value on respecting and caring for elders, often within the extended family structure, and the joint family system, where multiple generations lived together in the same home, traditionally provided a safety net for the elderly. However, urbanization, migration, and changing lifestyles have led to the erosion of the joint family structure, leaving many elderly individuals isolated and with limited family support, if any. The challenges being faced in senior care are health care. Access to quality and affordable health care, particularly geriatric care, is a major concern, especially in the rural areas. Financial security. Many elderly individuals lack adequate financial resources and are dependent on family or government support, which is often insufficient. Social isolation and loneliness. With smaller families and increased mobility, many elderly individuals experience social isolation and loneliness. Lack of infrastructure. Urban infrastructure often lacks senior-friendly features like ramps, elevators, and accessible public transport. There are several government initiatives and support for care of the elderly. To name a few, National Policy on Older Persons, NPOP, the National Program for the Health Care of the Elderly, NPHCE, Maintenance and Welfare of Parents and Senior Citizens Act, and various other social security schemes. The way to move forward is by strengthening healthcare, expanding geriatric healthcare services, especially in rural areas, and improving access to affordable medications are crucial. By promoting economic security, enhancing pension schemes, and providing opportunities for senior citizens to participate in the workforce are essential. By combating social isolation, creating support groups, promoting community engagement, and raising awareness about elder care can help reduce loneliness. By developing age-friendly infrastructure, making urban environments more accessible and senior-friendly through better infrastructure planning is vital. And by raising awareness, sensitizing the younger generation to the needs and challenges of the elderly is crucial for fostering a more inclusive and supportive society. The question that comes to our mind now is, why is care for seniors in the news? The recent news of seniors confined in a so-called old age home near the country's capital, where they were found in chains and tied up like petty criminals and surviving on a diet of biscuits and glucose, was appalling to one and all. This simply shows the degradation and apathy with our moral values and the extent of disintegration in our social fabric. Sometime back, the Niti Aayog released a position paper titled Senior Care Reforms in Our Country, Reimaging the Senior Care Paradigm. In our country, senior citizens, that is people aged 60 and above, currently comprise a little over 10% of the population, that is about 140 million. 58% of the total number of elderly are women, out of which 54% are widows. 70% elderly people reside in rural areas. 75% of the elderly have one or more chronic diseases, and around 20% of the elderly in our country have mental health issues. Food insecurity is increasing among our country's elderly. 78% of the elderly population survives without a pension. Only 18% of seniors are covered by health insurance. Health-related expenses are the most common cause of indebtedness, which is around 26% in urban areas. The challenges and issues being faced by the elderly are in health domain. Quality health care for the elderly remains a challenge as multiple service providers continue to work in isolation. The health system at present is focused on reproductive, maternal, communicable and non-communicable diseases, and with a low priority for geriatric care. Only 12% of the elderly people are aware of the Maintenance and Welfare of Parents and Senior Citizens Act and the Annapurna scheme. Regional divide, considerable rural-urban inequality which is disfavoring the rural residents. Gender-based disparity, female older adults undergo the experience of poor aging in compared to their male counterparts. Inadequate elder-friendly infrastructure, basic facilities like accessible transportation, disabled-friendly toilets, accessible buildings, etc. to enable unrestricted mobility are either missing or not maintained properly, thereby limiting the access of seniors to public places. Economic domain. Many adults reach old age without sufficient savings, insurance, or public or private pensions to live on or to fund long-term care. Nearly 70% of the elderly are dependent for everyday maintenance on family and relatives. Elder financial abuse has received recognition as a growing socio-economic and public health problem. In the digital domain, insufficient digital access, paucity of digital training, modules for the elderly. According to a survey, approximately 86% of seniors were digitally and computer illiterate. Contribution of care work and care workers remain neglected. Care work and care workers remain undervalued and underpaid in our country. Care work is often viewed as a low-skilled job and is mostly performed by semi-literate persons. There are several key learnings from across the world. Some examples are from Japan, which has a program of Healthy Japan 21 program to promote active aging through smart walk, smart diet, smart breath, non-smoking, and smart checkups. In the United Kingdom, free public health care to all citizens through their National Health Service (NHS). In Germany, health care coverage is largely driven by private insurance, with the government playing a policy-making role. The question that now comes up is how to improve the overall care of our seniors. For this, the recommendations could be: firstly, ensure health empowerment and inclusion. Promote health literacy among seniors and their caregivers. Increase accessibility of services. Insensitivize preventive health. Strengthen research and set up research institutions to enhance the knowledge repository of geriatric health care. Develop low-cost healthcare delivery models, practices for filling the infrastructure gap through PPP modules. Secondly, efforts to ensure social empowerment and inclusion. The first is awareness of rights and available facilities. Legal reforms of the elderly concerns and awareness thereof. Build and strengthen provisions of assisted living facilities. Establishing peer support groups where seniors can exchange experiences and information about various issues. Establishment of a one-stop centralized portal. Thirdly, efforts to ensure economic empowerment and inclusion. Reskilling of the elderly population, initiatives to foster age-friendly labor markets and employment opportunities, increase coverage of public funds and infrastructure, extending pension support to the elderly population from the unorganized sector as well. There is a need to revise pension amounts to account for inflation. Lastly and most importantly, efforts to ensure digital empowerment and inclusion, improving access to digital devices for seniors by making them affordable, and focus on increasing digital literacy, especially among the elderly population. There exist several senior care support frameworks in our country. The first being constitutional provisions like Article 41, like the 7th schedule of our country's constitution. Legal measures like the Section 20 of the Adoption and Maintenance Act 1956. Like Income Tax Act allowing senior citizens to claim a discount in tax, like the Maintenance and Welfare of Parents and Senior Citizens Act 2007, like NALSA, Policy Support, National Policy for Older Persons, the NPOP, National Social Assistance Program, welfare schemes and programs, Senior Able Citizens for Re-employment in Dignity or the Sacred Portal to connect senior citizens with job providers in the private sector. The Senior Aging Growth Engine SAGE initiative. It has been launched by the Ministry of Social Justice and Empowerment by the government to promote and incentivize senior care products and services. Other welfare measures include the Senior Citizen Welfare Fund, the Accessible India campaign, among several others. In conclusion, while our country has a very strong foundation in its cultural values as well as government initiatives, the status of our senior care requires significant improvement. Addressing the challenges related to healthcare, financial security, and social support is crucial to ensure a dignified and fulfilling life for the growing elderly population of which I too am a part. Jai Hind, Jai Bharat.